A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
Hear that alarm clock? If you are not up before, it's time for you to rise and shine now. And while you're having your sugar-free, healthy breakfast, listen to 15 eye-opening minutes.
My eyes open!
With the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. The power to make a difference. Good morning, Larry Mears. Also morning to Hensley Ben, Marcel Curtis, and all of the friends and fans of this Saturday morning show who are tuned into VOB right now. It's Peter. Peter boys, you remember me from last week and the week before and the week before? I hope you remember, and I hope you're also remembering all of the healthy tips that you hear on this show every week. And not just listening, but taking all of those tips into practice. Don't just let it go through one ear and come through the next. All of this knowledge complements the Maria Holder Diabetes Center, located in Warren St. Michael behind Morris Gibson Polyclinic. Once you're a diabetic or pre-diabetic, they have got your back as it relates to diabetic services in Barbados. You might be home listening to VOB right now, and you might have been recently diagnosed with diabetes, and you might have questions, or you might have had it for some time and need to be reminded of the characteristics of the condition, especially as it relates to children and younger people. We are going to go to pediatrician and trustee with the Diabetes Foundation, Dr. Misha Lashley, for some insights on diabetes. Take a listen while you drink your tea. My name is Sugar. Welcome to the show, Dr. Lashley.
Thank you very much for having me on today.
Diabetes is sometimes seen as a condition that impacts on older persons. How does it impact on younger people as well?
That's an extremely important question. Diabetes in children, when we look at this, first of all, we have to think about what really is diabetes in children. And there are two forms. There are conditions that we describe as being what we call type 1 diabetes, which is the diabetes that people commonly recognize that occurs more in childhood than in adults. But we also have to recognize that there is another type of diabetes called type 2, which also occurs in children. In the beginning, I just want to mention a little bit more about what type 1 diabetes is. This is a chronic autoimmune disease that affects children and young adults. And it occurs when the organ in our body called the pancreas stops producing the hormone called insulin. And this hormone regulates the blood sugar levels in the body. So without insulin, the body cannot use glucose. The glucose builds up in our bloodstream and causes high blood sugars. And this is what diabetes really is. In children, the symptoms of type 1 diabetes can occur very suddenly and can be quite severe. This is a little different than type 2 diabetes. So in children, they will often present to us with a fairly recent story about passing a lot more urine, being very thirsty, having weight loss, fatigue, and sometimes even vision that is very blurry. And if those symptoms are left untreated, then that person or the child presenting with type 1 diabetes can present quite ill and often have to be managed in an intensive care. So children really need to be looked at carefully if their parents suspect any of these symptoms. They should be aware of things like if there's a family history of diabetes, it might be a little bit more common for your child to have some of these symptoms. But since it is an autoimmune disease, there may be no family history of diabetes in that child that presents. But if the child presents with any of the symptoms that I mentioned, such as urination, thirst, fatigue, and weight loss in combination, the parents should definitely think seriously about this and take their child to a doctor immediately.
Could you give us some more factors on how type 1 is different to type 2 diabetes?
Even though type 1 diabetes is the most common form of diabetes in children, we are seeing type 2 diabetes becoming much more common even in the younger child. And this is different from type 2 is different from type 1, both in its presentation, the kind of background of person that it presents in other words, your genetics, and how it is managed. Type 2 diabetes in children is often associated with that young person or child who is overweight or is obese and has a more sedentary lifestyle. And what I mean by this is the child who doesn't exercise as much and has gained weight. And this is something we've been seeing even more commonly over the last couple of years. And then what happens to these children is that the body becomes resistant to insulin. They still produce it, but the body does not utilize insulin in the same way, and those then lead to the high blood sugars. Unlike type 1, which is an autoimmune where we cannot have any control over it, type 2 diabetes has a stronger genetic component and is often linked in patients who have a family history in their parents, grandparents, or in close relatives. The symptoms of type 2 may be a little bit different in that they will not present so suddenly and severe, but usually over a longer course of time with similar symptoms such as thirst and urination and some weight loss, but they may also present more subtly with just chronic fatigue or blurred vision, or might even recognize that they have lost weight unintentionally. The management of type 2 is also different because unlike utilizing the insulin that is not being produced, we have to then modify how our lifestyles are. So this type 2 diabetes in children often involves combination of medication but also lifestyle modifications such as weight loss, managing diet, and increasing their physical activity. Children in type 2 disease will often have to be on medication in addition, as we have been finding that when diabetes is diagnosed in the younger population, the modification in lifestyle alone is not enough to control this illness.
Thank you, Dr. Michelle Lashley, for highlighting those diabetic issues that most impact children and young adults for us this Saturday morning. You at home will be hearing more from Dr. Lashley over the next few weeks, so make sure and keep listening. As you know, the Maria Holder Diabetes Center offers services specially for diabetics like diabetic retinopathy eye screening, podiatrist services to take care of your feet, and vascular screening to check the veins and arteries in your legs and arms if you have bad circulation. You can book any of those services by calling 243-3937. But there's also another organization in Barbados which looks out for diabetics, the Diabetes and Hypertension Association of Barbados. Let's get some more information about them. We think. So we welcome to the show President of the Diabetes and Hypertension Association of Barbados, Miss Trudy Griffith. Welcome to the show, Trudy.
Thank you so much, Mr. Boy.
What are the priorities of the Diabetes and Hypertension Association of Barbados?
So when persons hear the word diabetes or hypertension, they automatically think that this is a death sentence, and it is not. Once you take control of your diabetes or hypertension and you take control of your life, you will have a very good quality of life, and we are here to support you. Our mission is to improve the quality of life for persons who are living with diabetes and or hypertension and empower those who are at risk through up-to-date education, good self-management, and control.
What are the services that the Diabetes and Hypertension Association offers?
Wow, that's a very good question, Mr. Boyce. So the association has a wide scope of services that we offer. So if you want to come to our office and get your blood pressure or your blood sugar checked, we offer that service. We also do perform tests for your cholesterol levels as well as your HbA1c. So let me just take a moment to explain to the listeners what the HbA1c is. It's actually a test that does not allow you to cheat, because it allows us to determine what your blood glucose control or your blood sugar control has been like for the past 3 months. So therefore you can't hide from that test. We also have a program for children who have been diagnosed with type 1 diabetes, where we provide financial support as well as supplies to them. And this is something that we're able to offer through a collaboration with Insulin for Life USA, where we can get supplies into the island, and we can offer that to our members free of cost. So That's a very important word, free. Once you become a member of the association, you're entitled to a number of services that we offer so that you can really take control of your life.
Thank you, Trudy. You can find the Diabetes and Hypertension Association by calling 228-3422 or on Facebook or Instagram at DEH Barbados. And now it's time for our song of the day. Turn up your radio and get ready to dance. You can like this one this morning. This is one song that is guaranteed for you to have a good morning. As we encourage you to get up and dance, exercise, and get your circulation going, this is Peter Ram with the Good Morning Song. As we get you ready for Crop Over 2023, compliments the Maria Holder Diabetes Center and Republic Bank.
Ready. It's another episode when we out on the road. This is what we love to celebrate. This is not Hollywood. No, we don't come out of pose. We just party with no restraint. From pillar to post, I just party with most. I behave in the worst. My conduct is so gross. From the time that I wake, I'm ready to bust the gate. You just get mash up again. Crop over, good morning. Show them how we just jump up. Show them how we just free up. Crop over, good morning. Show them how we just jump up. Show them how we just free up.
Contact the Barbados Diabetic Eye Screening Program today at 243-EYES, 243-3937 to find out how you get your simple digital eye screening done.
Right now, let me start it. This is our destiny. Yes, it belongs to we. We making history. We celebrate. Just doing our duties, and nothing can stop we. We just party in some rage. From pillar to post, we just party the most. We behaving the worst. We conduct it so gross. From the fed to the stage, time I get in a rage. For the morning, much up again. Barbados, good morning. Show them how we just jump up. Show them how we just free up.
Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
Let me start the drinking, start the bumping, start the betting. Right now, let me start the drinking, start the bumping, start the lining. Right now, let me start the drinking, start the bumping, start the betting. Right now, let me start it. Oh, right now, let me start it.
We now go to a lady who has experienced the Barbados Eye Screening Program.
Well, I found the service is very good, and I would advise anyone who is a diabetic, give it a try because it definitely do work. Once you follow the plan and you follow what you're supposed to do, yes, it can improve your eyesight, and yes, it do work. It can work for you. It was very extremely helpful because, as I said, when they first went into the plan, yes, you saw your doctor, but they didn't only just stop there on concentrating on the eyes. I had a nutritionist that taught me the right way to eat, a physical therapist. I also was taught, as I said, the right way to eat, the portions that you do put on your plate is very important, and there was a chart that was given to me to follow. They just didn't tell me. They also gave me documentation. I had pamphlet, everything that I cannot follow, so I wouldn't get off track or go astray and do my own thing.
If you are looking for an institution that's dedicated exclusively to the management of diabetes in Barbados that offers a range of services that caters to both diabetics and pre-diabetics, the Maria Holder Diabetes Center located in Warren St. Michael is the answer for you. Whether it's diabetic eye screening, podiatry, or vascular screening, you will receive a level of service and treatment that exceeds any you might receive regionally or internationally. So if you are listening to your radio right now and need to make an appointment or need more information on any diabetic issue you might have, make that call now at 417-5980 or 243-3937. The last 15 eye-opening minutes you heard on VOB was brought to you of the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time, remember, your health is your wealth.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.